Hi guys. So I just wanted to come on here and make a really short video talking about some of the comments I've gotten on my Humira videos. So I'm not entirely sure where we left off or where I left off talking to all of you about my Humira experience. I believe the last I said was that I was no longer receiving the medication and that therefore I was no longer taking it. I was off of Humira for about 2 months, and then I made a breakthrough with someone at the insurance company to work out whatever the problem was in order for my insurance to cover my medications again. So I believe my last dose was in June, and then I stopped taking it for a couple of months, and then I believe I began taking it again in September. So there was about an 8 to 10 week period where I would have missed 4 or 5 doses. So I was off of it for a while. I did notice a bit of a change in my Crohn's symptoms, as I'm sure, as I'm sure you can all relate. No matter how well managed your chronic disease is, you still have good days and bad days. And I'm not going to sit here and claim that, Humira was a miracle drug for me or anything like that. I still did have bad days before I stopped taking it. Now, for those 2 months when I wasn't taking it, my bad days increased. But as a lot of you know with Crohn's disease, the inflammatory process takes some time. So in those 2 months, especially since I was really, really trying to take care of myself well with diet, exercise, stress reduction, all of that, I didn't really notice the crazy amount of symptoms that I had had before starting Humira and the other medications I had been on. Now, also, I want to mention that I am very fortunate in the fact that I have been able to lower my number of medications for my Crohn's disease significantly. Meaning, prior to, oh boy, I think it's been about a year now, I was on multiple medications, multiple immunosuppressants to control my Crohn's disease. After about a year and a half of really reduced symptoms, my doctor talked to me about reducing my number of medications to just the one. And since Humira had made the biggest difference for me in terms of my number and severity of symptoms, we decided to continue on the Humira and discontinue the other drugs. Now, no gastroenterologist should take this lightly. I had another colonoscopy, I had another round of extensive blood work, on top of the normal every 3 to 6 months blood work. Like, there were several tests done before we discontinued the other medications. So that being said, I was off of it for 2 months, noticed a significant uptick in my severity and frequency of symptoms, but like I said, it never went back to the crazy life-altering symptoms that I had had prior to really being aggressively treated for my Crohn's disease. So when I started back on the medication in September, I was afraid that it wasn't going to work for me because I had heard stories of people being on the medication for a while, and then you can build up a tolerance, which happens to a lot of people, but that does tend to take several years for those tolerances to build up. But I have also heard people who go off of the medication and want to start back on it, and their body no longer tolerates it, or your body builds up an immunity, or you become allergic to it after a while. Now, again, I'm very fortunate that did not happen to me. I started back on the medication in September, and by October, so at the beginning of this month, I really again noticed a drastic reduction in both the severity and frequency of my bad days, or episodes, as I sometimes call them. So I'm already back to really reaping the benefits of this medication. Now, I know I sound like an advertisement for Humira. And I want to say, this is my personal experience. Again, I only live in my own body and I only can make decisions for myself. So every time I talk about this drug or any drug, you really have to weigh the pros and cons. No one solution is going to be the same for any two people. It's like that with anything. So please, take my experience for what it is. It's my experience. It may or may not be the same for you. But I also want to say, I have been reading the comments that I've gotten on my 2 main Humira videos. And a couple of them have been about the side effects. So yes, specific cancers, are a known risk of taking this drug. Now, for me, my life was so altered by the symptoms I was having of my disease that I already felt like I wasn't living my life. So it was a pretty easy decision for me to say, I would like to improve my quality of life now at the potential risk of my quality of life later on. I'm young. When I was diagnosed, I was 20 years old. I had already been living with these symptoms for at least 8 to 10 years. And, it was a couple of years, more like 18 months, I would say, after diagnosis that I started on Humira. And it was because my quality of life was still so low. Then I said, you know what, I need to do this. I need to take the next step. And again, I cannot say that that's going to be the same for any two people. Everyone experiences different side effects. Everyone experiences different symptoms of their disease, and everyone has a different rationale for making the decision whether to or not to have any kind of treatment. I know for me, as most of you know, I am studying to be a dietitian, which means that I am all for, number 1, prevention. But number 2, finding alternative ways to treat things rather than just throwing drugs at a problem, because that doesn't necessarily fix it. It doesn't always, make it better. And these drugs, as we all know, can have some very serious consequences. And I don't even mean the potential down the road you're going to develop cancer, you're going to develop heart disease, etc. It's the very real now side effects, the daily nausea, heartburn, indigestion, the things that can affect your quality of life today. So I am all for finding alternative solutions to those things. But when the alternative solutions don't work, or if they aren't enough, then sometimes you have to go and you have to look at what Western medicine has to offer. And again, it's a cost-benefit analysis that you do, right, whenever you start anything. So that's one thing. And again, I don't want people to rely solely on drugs. I don't believe in that. I believe that you have to have a whole life and lifestyle approach to treating anything. And that's where diet, exercise, massage, counseling, they all come into play. And I have embraced many aspects of treatment for my Crohn's disease, and I want to tell you all that I don't think any one of them would put me in the position I am today, where I am a master's student, I'm getting my degree, I'm living far from home, I'm living far from my doctors. It's a multi-pronged approach that has got me to the place that I'm in today. So please don't look at my other videos and be like, oh, this girl is just advocating for Humira. No, I'm not. I'm advocating for everything. I mean, if you look at the other videos on my channel, which I really encourage you to do if you have any autoimmune disease, any digestive issues at all, I advocate for massage, chiropractic, counseling, probiotics, the use of certain supplements. Now, don't go out and buy the whole supplement store, but specific ones that'll help you with your life. Um, so I just want to say that. And a couple of other comments I've had are about allergic reactions or very acute reactions to taking Humira for the first time or the first few times. I know pancreatitis, shock. Gosh, there are many reactions that can happen to starting this drug. But I want to say that that's a risk with any drug. So again, weigh your options. Always weigh your options. There's going to be good things about any treatment. There's going to be bad things about any treatment. Now, the bad things about eating differently is just that you get constipated or you get diarrhea for a day and then you change what you're doing. The consequences of starting a new drug can be much higher. But again, you're always doing this with doctor supervision. You're always doing it knowing full well what the risks are and what the potential benefits are. And I guess that's what I want to leave you with. I want to leave you with the idea that you need to look at your disease. You need to look at your state of health from multiple perspectives. There's no one solution that works for everyone, and there's no one solution that works for an entire lifetime. It's always, we talk about this idea of dynamic equilibrium. Well, you have to be dynamic about your approach to keeping that equilibrium within your body, to keeping that state of health. So, multiple avenues to go down to treat any disease, and I want to say that well, Humira worked for me, it might not work for everyone else. And it's the same with azathioprine or Imurin, Remicade, anything, any drug treatment to treat such a severe chronic illness is going to have severe benefits and severe risks and side effects. You just have to look at it from what's going to be the best for you, and that's all that you can do, and you cannot tell anyone else how to treat their body, what to do with their body. It's not your decision, it's theirs. So please be supportive of each other, be supportive of me. We're all going down this path of life with speed bumps and obstacles and even roadblocks, and all we can do is support each other to get through them, past them, and go on to live a better life. And support is key. Support is one of those prongs in that multi-prong approach. So I've said my piece, and I look forward to any discussion down in the comments below. Just be nice to each other, be supportive, and be honest, be truthful, because that's the discussion. If you can't be truthful, it's not a real discussion. So, share your opinions, but be nice. Okay? All right, I'll talk to you again very soon.